Hello everyone, it's me Salina Tamang and I belong to a nursing field. So as per we are told that we need to give any kind of presentation on our specific field. So I'm here with a topic called identification and treatment of drug user, which is related to my nursing field. There is a saying, drug aren't cool, they make you look like a fool. So let's start from this slogan. I want to start my presentation. So here is a list of content that I have made and that contains introduction, identification of drug users, treatment method, conclusion, and there are some references that I have provided you, so you can have a great look on that and can get a little bit knowledge on this topic. So let's get started. So introduction. What do you mean by drug user? So it says that a drug user is someone who consumes substances, legal or illegal, that alter their mind or body. This can be occasional or habitual and may lead to addiction. So I have given you a link of a video where you can have a look and you can see that how drugs or how drug user behave, or how drugs behave in your body, how they alter your body function, or how they alter your cognitive behavior. So here you can have a look, you can enjoy the short video. And then let's go for identification of drug users. So how can we identify they are drug user? How can we identify the normal people and the drug user? So here are some signs. Talking about physical signs: change in appearances, weight loss, poor hygiene, or body odor. As you know, drug user, they are not that much keen to keep their self clean, because they don't have that much of cognitive thinking, or they don't have that much of time to make them look good or be hygiene. So talking about health issues, there is a breathing problem, track marks on the arm of different kind of needles, and then cuttings and different kind of injected needles, or frequent nose bleeding. These are the physical signs. Talking about behavioral signs, there is a withdrawal, social withdrawal. It means non-accomplishment of social relation, staying away from friends and relatives, not going out. So they have, in behavioral changes, they have this kind of social withdrawal where they stay away, where they stay very aware, very far from the friends, relatives, and with the society. So they most have mood swings. They commonly have mood swings. They include change in the behavior, increasing level of temperance, or fluctuating emotional state. They can't control their emotion. In that state, they can't control their emotion, they can't control their behavior, and their temperance is in very kind of fluctuating way. It can be sometime, the mood can be sometime very high, or the mood can be sometime very low. So we call it mood swing. Another would be neglecting responsibilities. As we know, negligence, not being responsive to one's duties at work or in the school or at a home. So these are the behavioral changes that, looking at them, you can identify, okay, they might be the drug user. So let's talk about identification of drug user in physiological or psychological indicator. So in psychological indicator, we can see memory problem, mental health problems such as inability to concentrate, or even in a confusing state, lack of motivation, decrease motivation for activities that were once enjoyable, or even discovered goals. They will have a lack of motivation in whatever things they are doing, that may be very much pleasure giving them before using the drugs. But as soon as they start using the drugs and they get trapped in the drugs, those activities and those kind of motivation things or motivation activities, that starts getting kind of very low, and they won't they won't get the same pleasure with that activities. Paranoia, aggravation of symptoms such as heightened level of anxiety or paranoia, a feeling of being watched or judged. They constantly feel like that if I get if I go out, or if I get indulged in the society, then they might be watching me, or they might be keeping eye on me, they might judge me. They have this kind of paranoia behavior, or they have this kind of thoughts inside their mind. And talking about emotional signs, feeling of guilt, apologizing or feeling sorry for using drugs or for a specific behavior. When they are in control of drug, they do a lot of behavior like aggressive behavior and a lot of behavior. But as soon as they are not in the drugs or they are not in any kind of symptoms, they feel like they have very strong sense of guilt feeling that they have been doing wrong or they did this wrong behavior when they were in the influence of substance or influence of drugs. Defensiveness, so adverse reaction to drug use or other related subjects. Secrecy, withholding the information about location or anything associated with the drug user. They are very good at this kind of secret keeping, so they think that if we pass out any kind of information where we are getting like where we are like sharing our location or any kind of like spot where they are using any kind of drugs or where they are doing any kind of illegal substances, so they want to keep that very privately. They want to keep it like very in a secrecy way. So these are the emotional signs of the drugs user. About the environmental changes, so drug implements possessions of needles, pipes, other similar objects that have anything to do with drugs. Change in friend groups, interaction with peers who may include drug users, thus the development of friendship with new friend. So it says that uh, as they changed themselves into a very kind of reserved friend group where the only substance users are there or drugs users are there, because they think that if they go and indulge in a kind of good friend environment or friendly environment, they may be like judged, they may be judged or like they may get any kind of comment which they are not ready for. So going into that journey, they always choose a kind of friend group where the drugs users are there. Thus, they don't want to develop any kind of new friendship or they don't want to develop any kind of new motivational friends or anything like that. Financial issue, desire for money for no apparent reason or financial difficulties. Other would be like general indicator, inconsistent behavior, unusual alteration from the normal behavior or social pattern of an individual, legal problems, involvement in legal issues related to drug use, example arrest. Yes, the identification of drugs user might be more, they will involved or they will like unknowingly involved or they will be knowingly involved into any kind of legal problems, especially like arresting with drugs, like finding getting themselves arrested by the drugs or having any kind of fights between them. And so this kind of activities they do and they make themselves trouble, they put themselves in trouble and they face all these kind of legal problems. Retraction, avoiding acceptance of the drug use consequence on life and relationship. And okay, treatment method for drugs user. There is a treatment method called detoxification. This helps drug addiction individuals with managing the physical symptoms of withdrawal in long-term treatment programs. Medication used include methadone or ibuprofen for opioid and benzodiazepine for alcohol, according to ASAM 2020. Medication assist treatment. The main goal of this method is to reduce drug craving withdrawal symptoms, making the recovery pieces more manageable. Medication use include methadone and buprenorphine, which are used like specially for reducing craving or any kind of withdrawal symptoms, for blocking europhic effects of opioid and alcohol also. So these all the medication they are mentioned by NIDA in 20 NIDA article. All are mentioned in NIDA article. Okay, so treatment continues here, like they can have like behavioral therapies also. So they are essential when dealing and treating underlying psychological enhanced addiction. The therapies include cognitive behavior, which we call like CBT, motivational interview therapy, contingency management, and dialectical behavior therapies. Support group or group therapies individual get per support in the community-based framework. It allows the participant to share their recovery journey, to motivate others and share experience that may have like really positive relation of what here will be experiencing here, hence learning new strategies that can help them to manage in a similar situation. Again, the next treatment would be holistic and alternative therapies. What do you mean by holistic and alternative therapies? So this kind of treatment involves provision of well planned recovery approach that addresses physical, emotional and spiritual well-being. It's not only talk, it's a kind of therapies where you don't only have a certain or specific approach, but here you include physical, emotional and spiritual well-being also. So the combined approach may include mindfulness, meditation, yoga and exercise therapy, art and music therapy, as well as massage therapy. Counseling. What do you mean by counseling? So individual, group or a family counseling to address underlying issue and providing emotional support, that is called as counseling. And we can go for rehabilitation program, inpatient or outpatient program that provide structured treatment and support. So this can be the next treatment also. So here I have given you the short story of addiction and recovery videos, so you can have a look and then can see how they have been, how a drug addict can change their life, how these all these kind of like support, like behavioral therapy, all this kind of medication therapy helped him, and he was like getting into a better position or like getting into a better health. So you can have a look on that. So these are my references from where I have been writing all those my presentation, giving you all these references. This is the last part of my presentation. Thank you.